I believe my family and friends thought it was a little crazy for me to leave my secure corporate job to pursue fitness and nutrition coaching. And I will say that I would likely not have done this even 4 years ago. But this podcast has opened my eyes to the multifaceted challenges of women's midlife health that even my 26 years in the health industry didn't teach me. I am much like you. Maybe you've been through menopause and now you're trying to figure out how you're going to ensure your longevity and mobility for the next 30 plus years. My mission wasn't to look like my 24-year-old self again, but I wanted to have energy, sleep well, feel comfortable in my clothes, and not be a burden to my children when I'm older. I want to control what I can control. I wanted to find a program that met me where I was and one that would undo all that diet culture had thrown at me. And guess what? You can lose weight, that belly fat, and feel amazing in your 50s and beyond. Are you ready to make a commitment to your future self? Shoot me an email or reach out on social media. We can chat about your goals and see if my program will suit your needs. Health, wellness, fitness, and everything in between. We're removing the taboo from what really matters in midlife. I'm your host, Michelle Folan, and this is Asking for a Friend. Breast augmentation surgery remains one of the most common cosmetic surgeries performed in the United States. In 2022, there were about 300,000 surgeries, which was a 4% increase over 2019. The procedure has a relatively low risk of complications, the most common being breast pain, changes in nipple and breast sensation, scar tissue formation, rupture, and deflation. However, some women experience a compilation of symptoms that has come to be known as breast implant illness, or BII. More than 100 symptoms have been attributed to BII, and studies are investigating potential reasons for the syndrome. Dr. Robert Whitfield is a world-renowned holistic plastic surgeon certified by the American Board of Plastic Surgery. He specializes in breast implant illness and pioneering surgical techniques. His expertise in oncology and microsurgery distinguishes him as a leader in the advanced breast explant procedures and innovative treatments like the no-cut facelift. Dr. Whitfield has garnered acclaim for his dedication to breast health and cutting-edge techniques, honored consistently on the Texas Super Doctors list and recognized as one of the best doctors in America. He is a trusted authority and sought-after resource to medical organizations, journals, and media platforms. And he also has a podcast. Dr. Robert Whitfield, welcome to Asking for a Friend.
Well, thank you for having me, and I really appreciate this opportunity to speak to you and your audience. I think this will be a very, very good show.
Yeah, so this was a topic that I've been wanting to cover because I know that the breadth of this syndrome or illness, it can be evasive in terms of diagnosis. But before we get into this, I was wondering if there's anything else you'd like to share, like where you grew up and where you went to school.
Yeah, so most folks don't grow up the way I did. I grew up in Las Vegas, Nevada. So I was born and raised there. My dad was a nuclear weapons inspector, and during the Cold War, that's where people grew up. They either grew up in White Sands, New Mexico, or Las Vegas.
And how was that growing up in Las Vegas?
Well, it was a very different place in the 70s and 80s when I grew up. So, and then I went through college and medical school in Nevada, and then I trained for an extended period of time at the Indiana University Medical Center in Indianapolis. It's a big tertiary care center in the state where everything kind of funneled into the center of the state, and we took care of cancer patients, burn patients, trauma patients. We did aesthetics. We did breast cancer reconstruction. So I had a really great training in general surgery and then in plastic surgery. And then I did additional training in microsurgery, aesthetics, and oncology reconstruction. And then I taught for 7 years at a university. And then I went to group private practice. And now I'm in solo private practice.
All right. So where did this interest in breast implant illness come from?
So it was a cancer patient had found me and came for a consult regarding becoming flat. So they wanted a breast reconstruction removed that had been done with implants. And I think it's becoming, and always has been, a technique that was probably underutilized, and more people are utilizing it now. It's being referred to as an aesthetic flat closure. And so, I've done thousands of breast reconstructions and now thousands of explants. So it started with a cancer patient who came to have an aesthetic flat closure, basically. And I did their case. And ultimately, when you're doing a reconstruction removal, if you want to think of it that way, you're trying to make sure a couple things are checked off. One, that the patient doesn't have any recurrent cancer. So that's first and foremost. My sister recently passed away from breast cancer after a long period of surviving from that disease. And the second thing is you want to make sure that they don't have an infection, because anybody who has a medical device in place, doesn't matter what it is, hip implant, knee implant, neural implants, cardiac implants, they all can get infected. So you want to make sure that the patient has and is armed with all that information so you can take care of them properly at the end of the day. So we did the patient's breast reconstruction removal with all the scar tissue and everything around it, sent it off to pathology. She had no evidence of recurrent cancer, but when her studies came back to look for any bacteria, fungus, mycobacterium, she had an E. coli infection. And so I would have been severely pissed off if someone had missed an E. coli infection of my sister. So I had to go back through all of my information and notes and studies and see how did I, not find this? And she had no external signs or symptoms of an infection. She had no laboratory changes. Her only finding, which a lot of patients who undergo chemotherapy and or radiation therapy or cancer treatments in general have a lot of fatigue due to bone marrow suppression, which is pretty normal. And she did have fatigue. But magically, when I treated her for an E. coli infection, all of her fatigue went away. So I would say that, this was the, moment where I was like, well, I wonder how many of these are wandering around the face of the earth. So you mentioned how many implants are done in the United States. Well, there's 2.2 million breast implants placed worldwide annually. So times 10 years gives you a lot of implants.
Yeah.
Over 20 million. And in my study that's going to be published shortly of 700 consecutive PCR tested samples, about 30% have biofilm. So that's a bacterial contaminant, predominantly Cutibacterium acnes, but other studies at Staph epidermidis. For your audience, all that means is there's bacteria stuck on the implant, and that can interact with your tissues, specifically breast tissues that have things like oleic acid in them, and create naughty metabolites that make you feel more fatigue. So it's a real problem. And, that began what's now, that was whatever year was that? 2016, I guess. Quite the odyssey. And, we've done several thousand explants now. We have a book about our process coming out, Sharp, which helps people get prepared for surgery, recover from surgery more efficiently. We have a detox program set up for patients. It runs about a year long. If they need more, then they can engage longer. And then, of course, we do surgery. I have more surgeons now. Dr. Chung has joined me to help offset what was a limitation in my ability to see patients because I'm only one person. And we have a really, I guess, for now I'm more curious about the next aspects of this. I feel like I have the genetics sorted out and many of the toxicity issues sorted out and the surgical issues. There are some individual nuances, but I have most of that sorted out. It's really, what are the next steps to get people even further along in the healing journey?
Okay. So first of all, I'm very sorry about the loss of your sister.
Oh, thank you.
That had to be horrible to have to watch, and it can be very helpless, particularly when you are a doctor. I am curious, though, when BII became a known entity. I understand that it's not really an official medical diagnosis at this point. No, the thing is, so an ICD is International Classification of Disease. And so the problem with this, if you went to your practitioner and said, I have headache,
I have fatigue. I have heart palpitations. I have GI problems with constipation, bloating, and I have joint pain and muscle pain, and I can't sleep. There's not going to be many GPs, practitioners who know what the heck is going on with you. They're going to be, that's perimenopausal, or you got a lot of kids if you're younger, or you work too much, or whatever. There's going to be all these, I don't know if it's an excuse as much as it's a chronic inflammation is how I characterize breast implant illness. I don't characterize it as quote unquote breast implant illness. I characterize it as chronic inflammation of which a medical device is playing a role. So when I think of it, and kind of how I do reconstruction, like I get posed a problem. If you have a really big problem, you have to break it down into a series of smaller problems in order to get a solution to that problem. So obviously, when I first started doing this, I would take out devices and scar tissue based on the example we mentioned previously, and that would help a certain number of patients. But this is a far bigger problem than just a medical device problem. So for everybody listening, autoimmune diseases, chronic inflammation, those have all existed long before implants. Implants started in 1962 in Houston, Texas, in the United States. Chronic inflammation has been around a lot longer than that. And autoimmune diseases have been around since the late 1800s when they were first kind of starting to be understood. So the world doesn't get to be a safer place day by day by day. It gets to be a worse place to live. The quality of the air, the quality of the fluid, the quality of the food. The products you use on your skin, ladies, are a problem. So if you're not putting your things that you put on your skin through the environmental working group, I would make that change today.
Okay, you have to explain what that is because I don't know what the environmental working group is.
So one of the big issues that each person has is they only have a certain amount of genetic ability to detoxify substances that are placed on their skin, ingested, or breathed into their system. So everybody's kind of heard of the MTHFR gene at this point. Almost, everybody comes in my office. I got the MTHFR gene, Dr. Whitfield. I'm like, yes. About 40% of the world has that gene. It's not a new thing. So that just means you don't methylate well. So that affects DNA repair mechanisms, detoxification in your body. So if you put something on your skin or you ingest a food that has, say, a glyphosate on it, which is a pesticide, the ability of your liver then to handle it reaches a certain point, and once that limit is reached, then you become more symptomatic because now your body no longer copes with the amount of substances that are creating inflammation. And we see this commonly in our breast implant patients that come to see me. They've, over time, sometimes it takes 10, 15, 20, 30 years for that to happen. Or there's a triggering event. And I did a show recently about this with a mold and a Lyme expert. These kind of things where you get toxic mold exposures and or Lyme exposures and or environmental exposures from like products. I had a patient have a organic wet wipe that had triclosan in it, which is an antibacterial, but they couldn't cope with that particular chemical.
Interesting.
And it built up extremely high in their system. So the kind of things that have made me more curious now are like, what are all these different substances that we get or come in contact with all the time that lead to problems? Now, in women, hormone imbalance is like, it's basically a given that somebody's going to come in and have a thyroid problem, sex hormone problems, regardless of age. So even my youngest clients will have, quote unquote, Hashimoto's disease. So hypothyroidism with antibodies. And so, we look at that and like, why are you having that already? That makes no sense. So some of it's diet related. And Isabella Wentz has written a bunch of books about correcting hypothyroidism from Hashimoto's disease with diet. So gut dysfunction, all these things that seem kind of perplexing when you go to the GP and say, I got all these problems. And they're like, yeah, you sound stressed out, or, here's an anxiolytic, or here's something to, settle it down. But that's not really the answer to the question, so to speak. It's like, what are the root causes of the chronic inflammation? So if we parse it all out, you have a certain amount of genetics that allows you to detoxify. When we look at toxicity burden, we use a urine tox report and looks for different chemicals, toxins from mold, heavy metals, Heavy metals are in the shells of implants as they're constructed. And then these environmental toxins can take a host of appearances and roles and things that we use every day. So like anybody who drinks out of a plastic water bottle, that plastic water bottle has something called phthalates in them. Phthalates are plasticizers. So they make the water bottle firmer. The issue is with that, it really disrupts your endocrine system. So the point is thyroid dysfunction, sex hormone suppression, estrogen toxicity, all these things get affected by these different inputs into the system of which you're trying to detox.
Well, so back to one thing that you touched on, the symptoms, because I read the symptoms for breast implant illness and it looks like perimenopause or menopause. I mean, I can see why the medical community would overlook some of these other issues because it looks like it's just, a sex hormone or thyroid type of issue that many of us go through. I mean, the list was long, but I was like, oh my gosh, well, 40 of these could be based on perimenopause or menopause. So these tests that you're running, you're doing these tests because you're in the know. But how can a woman who is just going to see her GP get some of those tests to try to delineate if there is some toxicity from heavy metals or mold?
Yeah. So the issue is traditional testing, serum testing, blood value testing that we're all accustomed to, which hasn't changed since I've been in medical school many, many years ago now, doesn't really highlight these things. So for all intents and purposes, I've learned about this through integrative care, functional medicine care, holistic care, and these are coupled to an interest in functional genomics. So like the Genome Project is the thing that changed and should have changed medicine for the better more quickly. It hasn't to date because we have some, issues with getting things done in our country. But if you look at the traditional medical model, you show up, you have a series of symptoms, and they associate that with a disease state, and they give you a therapy. That therapy could be a lifestyle change, diet modification, a prescription if it's an infection, or X, what that is. When I listen to somebody, I'm not really listening to come up with a diagnosis from that set of symptoms. I'm listening to hear how you detoxify and what your exposure is based on your history you give me, where you lived, what your work is, kind of diet you follow. And then that will make more sense to me than if you start rattling off a bunch of signs and symptoms that are inflammatory, because, yeah, I know all that. That's not the issue. The issue to me is I'm not trying to convince anybody they have something. All I'm trying to listen to is like, how do you individually detoxify? Do you have estrogen toxicity? Do you have really bad periods? Do you have PCOS? Do you have endometriosis? Those things are all coupled to genetics. Mm-hmm. So I don't think about it in my traditional Western medical education because that's not gotten me to this point.
Have the breast implant manufacturers made any changes over the last 25 years to how they're manufacturing, what materials they're using? Now, I know silicone came back in favor. Do you see, the other part of my question is, do you see any difference in saline versus silicone?
So the filler doesn't matter.
Okay, filler doesn't matter. All right.
No. As long as it's an unruptured device, filler is inconsequential.
Okay.
The textured surface is the problem on devices that were made for specifically reconstructive cases. The texturing is too irritating. You can create a T-cell lymphoma. So I've had people have lymphomas. There's also these squamous cell carcinomas that are now associated with breast implants. So just like any medical device, none of these things are without their risks. And I think most patients who come to see me, they may have gotten implants when they were really young. And I never, so that all your listeners understanding, most of my background is cancer. So the youngest person I ever took care of was 24 with breast cancer, which is a very bad diagnosis to carry at a young age. So I did small numbers of implants, but in my life, I've had no trouble telling people no for surgery. So I never really cared about doing a bunch of cases for cosmetic results if I didn't feel like the expectation has to match the person's frame, and many people have some body issues. So if I couldn't help them realize what made sense for their frame, then I just tell them I'm not their surgeon, which is fine. So when we talk about like what are the problems with the implants have gotten better from a technical standpoint. Their shell integrity and things of that nature are better. The fillers really haven't changed much. The problem, in conjunction with that, more irritating surfaces. Now, our toxin exposures increases every year. The things we're exposed to, coupled to, having that, if you have a implant, I think that's the mixture where, to me, I see everything has a balance. And when you get out of balance, you start to have all these symptoms and problems. And all the symptoms and problems, just like they're associated with mold and Lyme or perimenopause or X, can happen without implants. So when I have somebody show up and they want an explant and think all that's going to go away, I'm like, no, it's not. Just so you know.
So I guess my next question would be, are there things that you may do first or try first before you would do an explant surgery?
So many people run my SHARP process, and that's basically a holistic program where you can look at all the same testing as a patient who's going to have surgery. And then the thing with trying to detox when you have implants is you can only probably do a certain amount of detox, because the more aggressively you treat yourself, say, for instance, I had a client who loved to sauna. So they would love to get in the sauna at 220 degrees Fahrenheit. So they basically started leaching chemicals out of their implant shell into their system, and we saw it on their toxicity tests. So they had all these heavy metals. They had lead, tin, cadmium, all these different things would show up in their test, and they felt really bad after a sauna session. Well, it's because you were heating up a device and actually affecting the shell characteristics and leaching chemicals out of it. So I got in a bunch of trouble on the podcast I did with Lauren Bostic, because she said, I think I'm melting my implants. And we used to joke about it in the office. She's like, I think I'm just melting my implants, Dr. Whitfield. And I was like, yeah, you're just melting yourself. You keep, roasting yourself in this thing. And so we said that on our show. The proper terminology for this is leaching. You're leaching chemicals out of the device into your system, and your body's got to metabolize those things. It goes through your liver, it gets excreted in your urine by your kidneys, and that's how it works. So the reason I don't do like hair analysis or other things is, I want an objective measurement. So if you came to me and said, hey, I have all these problems. So you look at your person's genetics and their toxicity burden, their gut health, their food sensitivities, their hormone balance, and then some new metabolomics testing we have. And you can paint a pretty broad picture of what's going on. And then you can, set them up with a surgical plan. You can set them up with a detox plan. We run those concordantly for about a year, because you can't live on this earth for 55 years like I have and not have a series of exposures and think that I'm going to solve all that in a few hours in the operating room.
Okay. What are the physical considerations regarding explant surgery? How's it performed is the first part of my question. And then what about scarring and then loose or sagging skin? How do you manage that and the expectations for your patient?
You said the quiet part out loud, expectations. I was waiting for you to say that, because everybody who got augmentation got it for a reason. It's not something that I can go back and undo. I've had people tell me they were bullied as a middle schooler. I've had people tell me that they watched Baywatch as a child in Germany. I've had people tell me, it's a Barbie doll thing. I mean, the list of things I've been told regarding why this came to fruition for them is going to be a very personal thing, and I can't undo that. I want to say trauma, but I can't undo the mindset. That's somebody has to decide that they're going to make that change, and that's going to create a whole new series of issues for them from a mindset standpoint. So we're We have healthcare professionals that we recommend for that because I'm not a psychologist. So from a physical expectation, what I try to do is if we're going to remove devices and scar tissue and do all this work, if I can add volume back with a fat transfer, both myself and my colleague, Dr. Chung, do that. If someone has a sagging breast or something that's really stretched out, then that's when you offer some type of skin lift or a mastopexy. And typically we'll make those recommendations based on, what we see. Option 2, explant, and then explant and take out all the scar tissue is one which I think makes sense when you think of it from infection and an oncologic viewpoint. So I've had people have, after the fact, breast cancer and lymphoma. And you never know really who's going to have that, provided a very unique set of circumstances when someone has one side get really swollen all of a sudden, and then you can check the fluid and see if that's a lymphoma. But in general, you don't know these things till after the fact when the pathology is examined. And Tiffany Blackman's a patient of mine who credits me for saving her life because I found her breast cancer before it became a issue. So it was a deep lying cancer, which was going to be hard to find. And obviously I've done a lot of surgery. So, you don't spend any time patting yourself on the back because the next time you do something, you may not be able to do that for somebody. But we identified that, took it out intact with a good margin for her. She's been evaluated for high risk. And, those things are important, right? We don't want to have anybody have a removal and have cancer left behind. We don't want to have somebody have a removal, have infection left behind. Had I not taken that tissue out properly on the very first case, I would have just left an E. coli infection in somebody. Now, they may have gotten better. They may have not gotten better. They may have kind of meandered around and still felt bad. But in those cases, and about 30% of the cases of mine, those have contaminants in them. The cancer cases are going to be, pretty rare, but still, if you miss one of them, what if it was your sister, your mom?
Right.
That would be, I can't, I sleep really good at night. I know what I'm doing. So every time I get done, I'm fine. I don't think, got to worry about that.
Right. You're obviously very thorough because now you really know the implications of the miss, right? So what is the most common symptom that you hear?
The most common symptom is usually something related to fatigue.
Okay.
And fatigue for women are extremely resilient in general. They tolerate more pain than males. They tolerate being more tired than males do because they're the primary caregivers for children, their families in general. They work. They do all these things. And so they just kind of push through all this stuff all the time. And I feel like it has to get really bad before a woman shows up or starts really trying to figure this out. Because I think in general, once again, extremely resilient group of patients of mine for sure. So it gets, and that's why I get like they come in, they're like, Dr. Whitfield, I feel like I'm dying. Like I used to not really understand the gravity of that statement, but that is such a fatigued person that they no longer feel they can get up and push themselves like they've been pushing themselves all this time to take care of their kids or their whole family or their parent who's ill or whatever the case is. It's a very profound statement when somebody tells me that. I don't take it like it's not a flippant statement when they make it.
Well, and women, I mean, from doing this podcast for 2 years, Dr. Whitfield, I can tell you that one of my messages to all women is you have to care for yourself. You cannot pour from an empty cup. And sometimes we let symptoms such as extreme fatigue go to the point where we just can't take it anymore. And that's kind of how we're wired, good or bad. I am thinking about the breast implant manufacturers. How have they responded to these trends in BII? Or have they? I knew this was going to be a question that was going to strike a chord.
I don't speak for industry. So I that's, you'd have to interview an implant manufacturer. I would say when they did their recall worldwide, they knew exactly what they were talking about. They had done the actuarial analysis and knew that they don't have to do anything. So if your audience understands that there's liability, and these folks, they put all that on me and the patients.
Yeah.
And they basically say, figure it out.
Was this recall due to the textured implants? Was that?
Yeah.
Okay. All right. And when did that happen?
Oh my gosh. Was that the summer of... What summer was that? Yeah. That's... God, I can't even remember. It wasn't when I was president. It was before that. Might have been summer of 19. I don't think it was summer of 20. I don't think it was COVID. But it was a very predictable type of response.
Okay.
Basically, they said, if you have somebody with extra devices in who wants them removed, we'll give you a saline smooth product for free. And then you figure out how to cover the expenses for both you and the patient. Because, so that everybody listening understands this, the patient is not the customer. The surgeon is the customer.
Yeah, because they're the ones purchasing it.
Correct.
Got it.
So now all of the burden is placed on the surgeon to interact with their customer, because the surgeon is actually the implant manufacturer customer. So that everybody understands what's going on. So they know that all they have to do is give me another product. They're going to write off their losses, right? Because that's what a company is going to do. And then I'm going to figure it out with you. I'm going to determine, next steps, right? Because now it's my problem.
Right. Got it.
That's basically what they did.
Okay. I do have a question off the topic a bit. In reading about in your bio, I saw that you have innovative treatments like the no-cut facelift. Can you talk about that a little bit?
Microneedling has been around for a long period of time for everybody listening. So microneedling is just, you could probably get it at a day spa where it's just a little pinprick and you might get a little welt. And the whole point is to stimulate collagen synthesis, because after, we'll say 30, 35 years old, your collagen and elastin content in your skin, which is what gives you youthful skin, goes down. So we did a combination of radiofrequency skin tightening and microneedling with or without a neck lift for faces for a long time. Because I used to do all my facelifts under local, especially post-pandemic. I mean, you just basically had to do everything under local anesthesia. But I was doing that anyway. And I had a series of patients who came to me for revision facelifts. And if the first facelift didn't work, the last thing I was going to do is repeat what the other surgeon had done. So I just wouldn't do it. I would do this radiofrequency skin tightening treatment, or I would do the microneedling, or both, with or without a revision neck lift that was all minimally invasive. And the minimally invasive neck lift, we just named Zoom lift because everybody was on Zoom during that time. And it was featured in Elle magazine as the Zoom lift and everything. So the advances that then came to fruition were a micro-coring technique. So microneedling, the needles are solid. Micro-coring, the microneedles are hollow. So just like if someone went and got a vitamin drip, an IV, after the IV was done, they would take the IV needle out and then apply pressure. And as long as you didn't bruise from it within, a day or two, you couldn't even see that. So microcoring's premise is you can remove skin without a scar because the microneedle is so small. So if you just think of what a facelift surgery is about, it's about excising skin. Most of the time, it's about a square inch or so. It's not a lot of skin. So with microcoring, we'll give you a number. We'll say about 26,000 microcores can equal about a square inch of skin. So you can do that on the face, the cheeks, the neck. The device I have is called Elocore. The combination of techniques are using face tight, the Zoom lift, and then Elocore is the microcoring technology with or without your own stem cells, because we have a stem cell device here. I can take the fat out of someone's love handle or abdomen and convert it to your stem cells. It takes about an hour and a half. And then we can aerosolize that, or I can inject it on top of what we're doing. And then we just put you in our hyperbaric chamber, because there's nothing better than, right after getting something done like that, to get some more therapy with, oxygen. And then we have red light therapy in the office, and we have nano V for increasing protein folding and recovery. So there's lots of tech that's changed how I approach things. And I don't like scars that are visible. Everybody who gets a facelift is going to have a visible scar. Everybody who gets a tummy tuck is going to have a visible scar. So we have procedures that are smarter, if you want to think of it that way, that leverage technology and our ability to contour and tighten skin and do these other things that are more, they're not in the future. They're here now.
Yeah. What's the recovery look like with Ellacor? Because I've had microneedling done.
So we run our programs so that we know how you're detoxing, so that everybody understands this. I don't do anything that's not aggressive. Everything I do is very aggressive. So with that, you have to know how someone is going to detox. And so we'll look at someone's genetics and toxicity burden and run the same program we would for surgery. Because if you do something with Ellacor to somebody who you don't really understand that about, they can have prolonged redness.
Okay.
But I just had somebody fly in recently from out of states, from New Mexico, and before they left, they were already, from a redness standpoint, really, really on their way to diminishing and resolving that, which is what you want. I've done the same thing for my wife, so I've had to look at this daily over time. And then, of course, her friends fly in and want to have it done. And then, I have colleagues and media people who want to have it done because they don't want to have a facelift scar, etc. So there are, these ways of natural appearing rejuvenation are more of my interest. I don't really have any interest in the unnatural. Too many of those wandering around the earth already.
Oh, I hear you. This is a personal question. What is one of your own pillars of self-care? What do you do for yourself?
So every day that I don't operate, I get up between 4:30 and 5:30 and I work out. And then I come I do hyperbaric. So right before we got on, I was in my hyperbaric chamber. I have a red light. I have a nano V running right next to my head right now. That increases recovery through enhancement of protein folding. I do intermittent fasting. I eat mostly a high protein diet. I don't really take in a bunch of bad carbs. I use a lot of tracking of my sleep. So I'm really asleep. I look at a lot of metrics and track.
Well, I have to say that a lot of what you're doing is what I think we're all trying to encourage. Getting good sleep, eat a lot of protein, try to get your workout in early in the day, early morning sunshine, all those things that we can control is a great first step.
Yeah, for your audience, people ask me what they can do right away. I get thousands of inquiries all the time about this. And so the things that you can do are all behavioral, and behavior modification is the hardest thing to change, right? So first thing you can do, if you don't want to work out, just get up and go for a walk. Second thing you can do is think about improving your air quality, fluid quality, and food quality. So everything says organic. That's actually not true. You have to be careful about that, and always, be critical about what you're putting into your body. Don't, a lot of people are coming out now and disputing things about seed oils. I can tell you, if I eat seed oil, which I did recently out of town, I get sick from eating seed oils. So I don't eat seed oils. I'm very careful now about what I eat and what I drink. I don't ever drink. My God, I can't even tell you the last time that I drank something that was a soda. I have no idea, to be honest. You have to be careful with, if you're a coffee drinker, you can't drink coffee that has mold. You have to be extremely careful about coffee.
How do you know if your coffee has mold in it?
So if they are mold free, they'll indicate that. And you have to look up brands like Danger Coffee's mold free, Keon Coffee's mold free.
I assume none of those come in a Keurig cup. No. I knew you were going to say that.
No, you have to be like, if you're going to get on this, and I have people all the time, they're It's hard. It's not an easy thing to do. It pisses my wife off that I'm so difficult with some of these things. But the fact of the matter is, I just turned 55, and I want to be around to watch my grandkids, and I want to have my brain intact. And one of the leading causes of problems with your brain is sleep apnea, and I have sleep apnea.
Mm-hmm.
Now, I'm not a heavy person. I'm relatively, fit, but I have a narrow airway, so I have to wear a CPAP. So Alzheimer's is not something I'm interested in having.
No.
Anything wrong, as it relates to brain health, I'm very interested in not participating in any of those disease processes. Cardiovascular health, number one, killer still is that. So get yourself up, work out. You don't have to, run 10 miles. I mean, I don't run at all. I mean, I'll row on a machine, or I'll ride a stationary bike because there's low impact. So women should do resistance training to help, fend off osteopenia and osteoporosis. Women should take vitamin D3, K2, because many of the patients I see have really limited absorption, transport, and uptake of vitamin D. And that's the number one, thing I would say for women. And then just don't eat gluten. Don't eat dairy. Pay attention to what you're cooking your food in.
All right. You gave me way more there than I was expecting. So thank you for all of that. I think it does support, again, what I said before. It supports a lot of the messages that a lot of my other guests have been speaking about for the last 2 years. And I think it's great hearing it from your perspective because you're a surgeon. I would like you to tell the audience, Dr. Whitfield, where they can find you and also your podcast.
So we are all over the place, but if you just type in breast implant illness expert, that'll reroute you to either my YouTube channel, one of my websites, Instagram, all these things that I have to make sure everybody's getting there from TikTok. Sorry, I almost forgot TikTok. And those things are meant to help you better understand the problem. It's not a simple problem. I think it gets, unfortunately, in some aspects it's being minimized, but the content we've put together for you is to better explain, what you may be experiencing or a friend or family member is experiencing so that you can better understand it. And then from that, make some behavioral changes moving forward, like we just discussed. And then if someone ultimately needs surgery, obviously that's a bigger conversation.
Got it. Dr. Robert Whitfield, thank you so much for being on Asking for a Friend.
Thank you for having me.
I am so grateful for the ratings and reviews from our listeners. Did you know that your reviews help other people find Asking for a Friend? If you like what you hear, won't you please leave a review on Spotify or Apple? Thank you from the bottom of my heart.